All right. Well, we might make a start. Um, Welcome everyone. We've got a really exciting session today for all of you who are keen runners. For many of us, running is something that we just love to do, and gives us that freedom to get out and pull our shoes on and um, do the sport that we love. So what this session really is about how we can maximize running, how can we get the most out of running, how we can enjoy it the most, how we can prevent the dreaded injuries from happening, which is often one of the biggest sort of barriers to not only running itself but also improving. So obviously if you're consistently getting injured, it's really hard to improve. And we've been finding a lot of patients that are coming into the clinic just don't have the education that they need to be able to make really, really informed decisions, whether it be around strength training, whether it be around the running itself, whether it be around footwear. So we thought we'd put together a masterclass. We've got some really, really great people who are going to share all of their knowledge with you around getting the most out of your running. And we're mindful that there's some big running events coming up. We've got the Sydney Marathon as well as the Melbourne Marathon Festival not that long away. So a lot of these sessions a lot of these things that we're discussing are things that are actionable. You can start doing them now. They're going to hopefully benefit you and your running straight away. And if you do need any help, we're always here to give you a helping hand. So I'd like to introduce our team. We've got Lockie Ash Smith, who's our sports podiatrist, and we've got Sean Rogers, who's our sports physiotherapist. Both have a real passion and interest in running. Both come at it from slightly different angles, so you'll get a really good, I guess, combination and different approaches on how you can best enjoy and maximize your running and running performance. For all attendees, we've got a special running offer. Basically, we're offering for a full hour session. We will do a detailed assessment. We'll do some strength testing so you can see the strength testing there, obviously specific to you and your issue or where area you'd like to improve. Running gait analysis, including discussing things like footwear, and putting a bit of a personalized treatment plan depending on what you're after. So we'll share the details with that via email after the session. We're also going to record the session, so it's a great opportunity for you if you do know anyone that's keen to get some information, timely information before the end of before the upcoming events, you can share it with them. So I won't talk any longer. I'll handball off to Sean. Before I do, just so you're aware, we're Melbourne Podiatry Clinic, and Sean works at Melbourne Sports Physiotherapy. Both of us work together, so we're two clinics that work hand in hand. We've got clinics in Essendon, Blackburn, Malvern East, and St Kilda, so really good coverage around Melbourne. And a lot of our team have a real passion and interest with running and have gym facilities to obviously be able to help runners keep running and then get them to the finish line as fast as they possibly can. So I'll leave it to you, Sean. Looking forward to hearing what you have to say.
Super. Thanks, Andrew. Hi, folks. As Andrew said, my name is Sean. I'm one of the sports physios here at Melbourne Sports Physio. Really excited to be talking all things running tonight. So we'll dive straight into it. We're going to talk mainly around two things from my point of view. It's going to be around dealing with injury, how can you recover even if you're mid-marathon block, and then two, well, how can I boost my performance? How can I actually get faster? How can I be more efficient on the road? So. In terms of dealing with injury, we're going to have a look at why we get injured. So it's important to establish this why before we deal into what we're going to do about it. If you joined us on our last webinar, which is probably 4 or 5 months ago, you would have seen this slide. It's really important. So why we get injured, there's a list of common injuries there on the right-hand side. I'm sure somebody or a few people, if not more than a few, have dealt with some of them. Achilles tendinopathy, patellofemoral joint pain or runner's knee, IT band pain. The list goes on. Approximately 80% of these running related injuries are from mismanaged loading. So, what I mean by that is usually too much, too soon, too fast, or where you don't have enough capacity to deal with the load. So I'm going to draw your attention over to the left-hand side. I've got a pyramid here with a bar across it. I want you to think about that like a set of scales or like a seesaw. This one is perfectly balanced. We've got our load on the left, our capacity on the right. Load is how much force we put our body through. That can be how many steps I've done today, if I've gone for a run, gym, bike, whatever it is. That's all the load that's being applied to my body. My capacity is how well I can deal with it. Capacity is made up of lots of different things. That can be strength, endurance, motor control, how quickly we can produce force or rate of force development, flexibility. There's lots of different things. These are some of the common things. And what we want really is for our capacity to be higher than our load. Injuries happen when we've got a mismatch. So on the left, when we've dipped into that red zone, we've got a load that's higher than our capacity. This is when we tend to pick up injuries. The ideal scenario is on the right. Our capacity is higher than our load, and that doesn't mean our load has to be small. That can be really, really high. That can be 80 kilometers a week. Just means that we have to work harder at getting a higher capacity than someone who runs maybe 10 kilometers a week. Now, in terms of that, jumping into what to do if you do get injured. So, if you've had an acute injury with loss of power or an injury that's causing you to limp, I would say seek a consult. That doesn't mean that you have had a catastrophic injury, but it's likely something that you want really specific advice and really specific management on. So if you've gone for a run yesterday, you felt a pop in the calf, you're limping today, or you feel like you can't get up on your tiptoes, that's when I'd say probably good to see somebody. But I would say for a lot of people listening, or the vast majority of us that are preparing for a race or just regular runners, we're getting a buildup of soreness, and this is we're going to talk about how you manage that. So maybe not something you necessarily need to see one of us for or a healthcare professional for, but how do you tweak your week, or how can you use some principles to get things heading in the right direction? The caveat to this is, look, if you're concerned, seek advice. But a lot of the times with these builds ups of soreness, we can do really well with a couple of things. Those things would be altering our week loading, following the peace and love principle, and then if it's not improving, having a look. So what am I talking about? Peace and love. You would have heard years ago about the RICE principle. So rest, ice, compression, elevation. That moved to price, protect, rest, ice, compression, elevation. We moved to police, and now we're at peace and love. It gets longer every year, but it's very helpful. So if you've had an acute injury, you don't find that you're limping, you don't feel like you've lost power, but you're sore, then I would have a look at this. A simple Google will bring this diagram up. Now, we'll not go into the intricacies of all of it, but this is a really nice pathway to go through if you've had an acute injury. So I'll just skip back to that. All right. So protection, very easy. If something hurts in the acute stages, probably best not to do it. Elevation, generally getting an acute injury up above the level of the heart, 10, 15 minutes at a time. It's really good to help with swelling. We tend to say avoid anti-inflammatories. We know this can impair tissue healing. It also says to avoid icing there. That's more from a standpoint of it doesn't really help with swelling, but it can help with pain. So I wouldn't say I'm against icing. Compression, again, helps with swelling. Education, it's what this is about tonight. And we'll go through some different things there. Load, we want to gradually get back and load the foot. And I'll give you, or the ankle or the knee or the hip or whatever it is, and we'll give you some ideas of what that might look like. Optimism. I think with that, allow yourself to be disappointed, allow yourself to be frustrated when you're injured, but then starting to turn that into, okay, I've got an opportunity now to get this sorted and be stronger than I have been before. Vascularization, that's about keeping up with cardiovascular exercise. So if you can't run, can you swim? Can you row? Can you bike? And then exercise. Generally, with injury comes an exercise or two to help restore that tissue health and get things back on track. We're going to jump back to this with an example in a second. A key caveat to this is, I would say, just beware of the bone stress injury. Unfortunately, a common occurrence in runners. What is it? It's an overload of the bone, where if it's left untreated, it can result in a fracture. This isn't designed to scare anyone, but it's just something that, look, it can happen, and if you're concerned and you have some symptoms, then it's worth being seen. Symptoms include pain worsening through the run, night pain, and pain on hopping. However, these symptoms do not have to be present for there to be a bone stress injury. So if you're concerned, seek a consult. If you're somebody who is, been dealing with some hip pain over the last few weeks, feel like you're tight in your hip flexor, it's not really going away, that's the kind of ones I'd be saying, look, get checked out, make sure it's not a bone stress injury, get a plan in place, keep cracking. But a quick note on that. Okay. So I think this is going to be a really key slide for people going through their marathon build at the minute, or even if you're just a regular runner or you're building for a 10K race or a half. So if you're starting to get a buildup of soreness in an area and you feel like it's not going away, consider a little training tweak. That might be considering taking a week of not running on back-to-back days. That might be reducing your step count for a couple of days, which sounds like a very subtle and small thing, but can make a huge difference. Consider cross training. So is that where we're going to bring in some swimming or a bike session? And sleep. So we get lots of questions about should I foam roll, should I ice, should I do cryotherapy? I call these 1% things where they might help a little bit, but we know that a big ticket item is sleep. So if you can prioritize, yes, the hours, but also the quality of sleep when you're getting some soreness, that's going to be really helpful. Now, if we're having a look at this little template here, this is my weekly training from a couple of weeks ago. So it's good timing with the webinar, but I picked up a bit of an injury probably 4 or 5 weeks ago now, where I was getting some knee pain and getting some Achilles soreness. Again, it wasn't one of those things that it was really acute that I was limping, but I was picking up some soreness. So this is what I did, and it's a nice example on how you might tweak things. So week A is my regular week, and that was going gym, gym, low volume run, medium volume run, rest on a Friday, back to gym Saturday, and a high volume run on Sunday. That week went really well, felt excellent. Week two or week B is when I picked up an injury. So it was normal Monday, normal Tuesday, normal Wednesday, and then I started to get pain on my Thursday run. So what did I do about it? So I had pain at the end of the run and pain the next morning in my Achilles. So Friday, I was following our peace and love principles. So again, what does that look like, or what did I do? I protected it. So I didn't do excessive step count. I didn't do excessive loading. I went to work and that was about the height of it. I didn't elevate. I didn't really have any huge swelling. I avoided anti-inflammatories. I didn't compress it. I didn't have any swelling. Thankfully, I've got the knowledge on how I didn't need a scan. I was happy that I was able to manage this load. My load that day was work, walking around, going through things in the gym with patients. Pretty optimistic about it. Thankfully, I'm a physio. I was able to manage this myself. I knew I was going to be back on track pretty quickly. And then I planned what exercises I was going to do, both from a cardiovascular standpoint and from a rehabilitation standpoint. So that was peace and love on the Friday. Saturday, I was in the gym. I was continuing with my peace and love, so no extra loading that was unnecessary, and I started some exercises. This is going to be different for everybody. There's no panacea, there's no cookie cutter approach that's going to work for all. For me, I picked up a little bit of Achilles soreness. I wasn't limping. I didn't lose any power. I was able to get up on my tiptoes. So I was doing some heel raises in the gym, barbell on the back, up into my tiptoe position, and I was holding that for a minute of work or 4 by 15 seconds with a bit of weight on my back. With this, I wasn't chasing pain. I had a little bit of soreness around a one, and I was very happy with that. I was starting to restore the tissue health of that Achilles. On the Sunday, that's when you've got your option. Are you going to do a low volume run? Are you going to do a bike? Are you going to do a swim? I didn't feel quite ready to get back on the road, so I was onto a swim there. Week C, so I'm starting to rebuild things up. It was gym and my rehab, low volume run, felt really good. Didn't go back to back on my runs. Friday it was a medium volume run, gym and exercises. And then I was toying with, do I do my medium or a high volume run? And I stuck with a medium just to scale things up. Now, I think the key thing with this is if you're picking up at a bit of soreness, how you structure your run. And I tend to structure my runs or my efforts to low, medium, and high volume. Color coded, green is low, orange is medium, red is high. And you can just see that in my injury week, I've taken out my high volume stimulus and I've replaced it with a low volume stimulus. So I'm not training, I'm still getting my work in, but it's a low volume stimulus. Same thing on the week after. I'm starting to scale things up. I'm getting into that mix between an orange and a red in terms of our medium volume on the Sunday, but I'm not going straight back into this high volume work. Week D, which isn't on screen, that's just back to my normal weeks there, where I'm low, medium, high volume, no restriction, pushing things back on. So this slide really is about if you're getting some soreness, and then soreness is part and parcel really of training for a marathon and running in general, even if it's training for 10Ks or halves or fives. But if it's ongoing and it's affecting your day to day, that's when you might consider a tweak. So for me, this was a bit more than a soreness from a run or that bit of muscle soreness. I was quite sore getting up the next morning, hence the little tweaks. Okay. So that's a little bit about on injury management. So in a summary there, if you're starting to limp or you're really struggling, get a consult. If it's soreness, you're tweaking the week, and I would use the medium, high, low volume kind of pathway for that of how you might tweak it. For those that are maybe not struggling with soreness, or even if you are struggling with soreness and you've got the time, we're looking to improve race times as well. We're looking to be more efficient on the road. We want to get better as runners and we want to get our times heading in the right direction. So, what would we look at? Strength training is going to be key. Generally, we say 2 to 3 times a week. Can we do some things that are single leg or split stance to make sure that we've got a bias on one leg? The key question to ask yourself is, well, what do you need? What's your training history? What's your injury history? For me, I have a big background in knee injuries, so I'm going to constantly have some quad work in my plan. Now, if you're a couple of weeks out from Sydney, now is probably not the time to start the gym. If you haven't been doing strength training regularly and you're 2, 3 weeks out from Sydney, I think we're going to be focusing more on our movement competencies, which you're going to come on to. But if you're training for Melbourne Marathon Festival and you've got 8, 9 weeks to go, you could definitely get some things going. Question is, how strong should I be? In terms of the knee, we know that quadriceps weakness is found to be a risk factor in the development of runner's knee. Here in clinic, when we set you up on the rig, if we were testing your knee extension as shown in the photo here, we aim for you to be able to produce 80% of your body weight on a knee extension testing. We know improving these levels reduces the risk of developing runner's knee. It also makes you more efficient. Let's not forget about endurance and movement quality. Strength is imperative, but it's not the be all and end all. It's going to be one of our big ticket items, but we don't need strength alone. We need a couple of other things. And that's what I'm going to talk a little bit more about. Lack of movement efficiency can expend unnecessary energy, which can hinder our ability to improve pace. So if we're not as efficient as we could be, we might be taking some time off our run or adding some time to our run rather. Now, with this, I'm going to go through a couple of videos of things that maybe aren't as efficient and how we'd improve them. The key for this is, look, everybody moves differently and people move differently for different reasons, but generally, this is the things that we would see in clinic and how we would go about getting them better. So, thank you, Matilda, one of our podiatrists, who agreed for me to film her hip. She's got right hip pain, and I'm sure you'll be able to tell that from the videos. You don't need to be a physio, and I told her I was going to say that. Let's focus on the left video. So, on this one here, we're getting into a bit of a single leg squat, and you can see this dump of energy into the inside of her knee as she goes into the squat. Whereas on our left, it's not perfect, but it's definitely better. We'll run through that right side again, or that left side video. Dump of energy, dump of energy, dump of energy. Matilda's got right hip pain, and this is probably one of the reasons why she can't control that right hip as efficiently. Now, when we get her leaving the ground into her stride, pretty good on the left, I would say. But if you watch her trunk on the right-hand side, she lands and then big trunk sway. So she can't control that leg, and she's starting to tip through the trunk to compensate. So Matilda's not very efficient around her right hip. So these are things that can be implemented right away in terms of if even if you're in a marathon build, because it's not like you have to do really heavy squats and you're going to be really sore. There's a couple of key things that we can do immediately that you should have a pretty good effect quite quickly, and it's not going to cause you loads of soreness. Now, a couple of things here. Let's start on the left. From left to right, they build in difficulty. So on the far left, when I'm on the step, you can see I'm trying to control my knee. So I'm trying to keep my knee nice and stable. I don't want it to wobble. I start off with a stick so that I've got some support, and then stick free in and out. It's a very, very shallow little dip of the hip, but starting to build that control around the knee. From there, I'm moving into more complex positions where I'm getting my trunk going over my knee while resisting my knee doing that same movement. Again, I'm keeping it in line with my foot, really starting to get really competent around the side of my right hip there. So we know that when we land and running, the side of our hip has to give us lots of stability so that we don't lose efficiency. Hence why it's important to be really good in these positions. And then finally, I'm starting to leave the ground. So I'm starting to help my landing mechanics. I've got this plate. I'm going to push it to the side. So I'm trying to push my center of mass into that position, and I'm trying to resist it. It was a decent rep there. So, if this video of Matilda looks like you and you're a bit inefficient around one hip or both, I would start at the start. Start with your step position. The reps don't need to be really high. It's about quality over quantity. So you might start with 15 reps or 3 by 5, and that might be once or twice in the week to start with. You might feel like after a week you've mastered that. You think, well, actually, that's really easy. Now I'll move on to stage two and then on to stage three. Again, it's not a panacea. And if you're starting to get pain with these, that's when, again, we're looking for to get a consult. But if you're thinking, look, I need to be more efficient, these are some nice options. What do we look at in clinic? So we look at lots of different things depending on the injury and depending on somebody's history. But two key things we would look at would be a single leg jump for leg power and a single leg hop for the stiffness or the springiness of our Achilles. So you've got me here jumping on my left, jumping on my right. We're going to come back to that in a sec. And then I'm having a bit of a hop here. And what you can see is I'm actually quite a lot less efficient on my right side. I have many more heel contacts from my heel drops, so I don't have as much spring on my right side. Let's come back to that in a second. I talked to you a couple of minutes ago about I started to pick up some pain 4 or 5 weeks ago in my running. I was getting a little bit of knee pain. I was getting a little bit of Achilles pain. And I wanted to catch this early, so I put myself on the plates and had a little check. Ignore the graph, focus on the numbers, and you can see I have much better power on my left-hand side. 17.1 centimeter jump height on the left, 14.8 on the right. And then similarly, peak power output is much better on the left, not so good or not as good on the right. There's about a 12, 13% difference. It's not hugely significant. It's not anything to worry about, but it's a little sign that, okay, I have a little bit of work to do. Because we know that reduction in leg power is putting progressively more load on the unaffected leg, and it's starting to overload the leg with insufficient capacity. What was the result for me? Left quad fatigue at 9 kilometers, right knee pain around at 9 kilometers, right knee pain around the 11 kilometer mark, and right Achilles soreness the next morning after the run. So the question is, what do I do about it? Again, from left to right, easier to harder. Starting to get into these really explosive step ups where we can get really good power output up into what we call a hip lock position. So that was stage one. Stage two, which is where I'm at the minute, is I'm into these Bulgarian split squat jumps. So I'm starting to leave the ground. I need that extra bit of power to get up into that position. And then finally, I'm starting to get into drop jump positions where I'm coming from a height back down and really explosive up. So with that, it requires more power again. So again, if you feel that, you might even test yourself at home, you do a single leg jump on the right, on the left, you might film it, you might feel, okay, I'm actually a lot better on my right here. Can I be more efficient in my running? I might start this cascade of sequence where I'm getting a really good aggressive step up position. I'm moving into these jumps and then moving into these drop jumps. Again, from a loading capacity with this, if you're a couple of weeks out from Sydney, I would keep the reps low, maybe 3 by 5, 3 by 4, once or twice a week. If you have a bit more time and you're heading into Melbourne, you might be going 3 by 6, 3 by 7, maybe 3 by 8 on these first two. With the drop jumps, I'd always keep those low. They're really high stimulus. You might only be doing two sets of this, 3 reps, maybe max. Again, not a panacea. If you're struggling with pain, it's when I'd want some nuance to this. But generally, this is a nice sequence to improve leg power. In terms of improving stiffness or Achilles spring, we've got a nice penguin march here on this left-hand side. I'm doing that weighted where I'm keeping the heels up, a nice stimulus down into the toes. I've got a supported pogo where I'm getting nice and stiff off that back leg, really springy. And then finally getting into, go back to my video, finally getting some tuck jumps, leaving the ground, really springy, and then keeping that going as I land. There's some strategies. The other side of this is, as we said, is load management. Look, a common mistake is too much too soon, too fast. I would encourage bone holidays, which is every 4 to 6 weeks having a little drop in loading. That would depend on, again, your history. For example, with me, a bit of a history of knee injuries. Every 5 weeks, I drop my loading 30%. So if I've done, I'll keep it pretty easy with the math side of things. But look, if I'm starting to do 30 kilometer a weeks, I want to drop that down by 30% on every fifth week. So okay, I might drop down to, 20, what's that, 26 kilometers. Those that are better at maths can call me out. That doesn't mean that I have to drop and then rebuild from there. It might be week 5 into my plan, I drop to 26, but then week 6, I'm back up to 32, 33, and I can build again. Listen to your body. Key takeaways from me: bone holiday every 4 to 6 weeks. It's not a hindrance, it's going to be a help. Movement competency can help improve your pace. So that's what we were looking at in terms of our single leg jumps, our lateral hip control, our stiffness. These are things you can implement now and can help you be more efficient on the road. Strength training, it's a friend, not a foe. And then look, soreness can be normal. It's part of the process of running, as I'm sure we've all experienced. Prolonged soreness and loss of function, not so normal. That's when I'd want to have a look at things. Last thing for me is good luck. I'm sure lots of you are in the middle of race prep and or starting a running journey or in the middle of a running journey. Best of luck with it. It's a very exciting time, and I'll see you all at both Sydney and Melbourne. One as a participant, one as fan. Thank you. I will hand over to Lockie.
All right.
Thank you, Sean. That was great. Yeah, some really good takeaways. Um, to some great takeaways, I think, to just get stuck into straight away. And I think like one of the key things to think about is if you're injured or you're dealing with an injury, it probably has the most significant impact on your ability to obviously perform on race day. So some really good tips I think that you can use to keep running and hopefully get to race day in good nick as possible. All right, we're going to hear from Lockie now. I'll hand over to you, all yours.
Awesome. So let's get this going. All right. So I'm going to sort of touch on three topics. One, sort of just reinforce the stuff that Sean's spoken about in terms of our strength non-negotiables, but from a foot and ankle perspective. So the stuff that we will be looking at in clinic for any sort of injury, running related, sport related, really good sort of food for thought. You'll probably be a little bit surprised by some of the metrics and the targets that we actually have. A big section we'll talk about footwear. So kind of want to give you two things. One, I have a big discussion about super shoes. Obviously, they're all the rage at the moment. So I just want to kind of break them down as to where they fit, how they actually kind of work. It's a really interesting thing that we're starting to learn more about, but also how you can utilize your current footwear setup and the things that you should be starting to consider. And then also, again, we'll touch on some of the performance aspects of running. So strength is absolutely essential. It's one of those things that I guess for a long time in the running community, strength was seen as a bit of a dirty word, and it was something that we avoided. We would steer clear of gyms, and it's probably the most neglected thing that we see with runners of all calibers, whether they're starting their running journey, you've been running for 5 or 10 years, or people that might be 20 and 30 years into it. Um, the big thing that we want to dispel is that running will make you big and bulky. It's not going to change that in a hurry. Um, it's one of those things that we can see really positive improvements both in the short and the long term. And as Sean demonstrated, like in a really short period of time, if we catch injuries early, it can be really positive. But also on race day, it can play a really significant role. So the goal tonight is I just want you to really try and understand how strength fits into your program, and sort of what those baseline measures are. But also, too, the big thing to be aware of is underloading. So if you are doing a little bit of gym work already, probably a simple mistake that a lot of people make is they actually underload their requirements for what we need in the gym. It's something that we see in clinic also with like, multiple injury histories. We often find people are doing the right things, but just not at the right sort of volume or the right load. So probably the most essential sort of lower limb assessment that we'll look at is your single leg calf test. So really good way of looking at this is we'll assess this using our valve system. So we'll do some strength tests so we can actually get some metrics. But a really simple way we can actually test that is by how many single leg calf raises you can do standing. So on the side here, you'll see a little chart. That little chart will give you sort of an age breakdown of what's expected for males and females. So for someone in the 20 to 29 age bracket, for males, we're looking at 37 calf raises, and for females, it's 30 calf raises. If you get bored sometime this week, have a shot at it yourself. You'll realize how hard it is. You think that's, I could punch that out quite easily, but it's actually really challenging. The big thing that we often see from a clinical perspective is we'll often see people can punch out high reps, but the form and technique isn't there. So they start to sort of cheat. They find little ways to make it a little bit easier to get those reps. So the kind of non-negotiables that I would look for in our strength testing with that single leg calf raise is we want a straight leg throughout. So we don't want to see that sort of knee start to bend a little bit. The other common one you'll actually see a lot is people like to drive through the hip. So we like to try and sort of almost thrust through the hip. For those of you that are maybe have a background in some CrossFit or have done some CrossFit or seen videos on the internet, have you ever seen a kipping chin up? It's a really good example of what we'll often see with people doing that single leg calf raise is they try and drive from the hip instead of at the calf. And this is a big thing where it's like we want to be doing good movements efficiently. A really nice way to check this is if you're doing this sort of stuff yourself or if you train in the gym on your own, take some video, get your iPhone, grab a little stand and take some footage and see what you actually look like. It's a really refreshing way of kind of seeing how you move. It's one thing to feel it, but it's really good to visualize it. And it's something that we actually see in clinic a lot. So we were doing a gait analysis, getting to actually see yourself run and move. It's really eye-opening because how you feel and think you look versus what we're actually seeing can often be quite different. The other thing with your calf raise is we want to make sure that you've got good speed. So we don't want this to be a really rushed movement. We're not trying to smash these out as quick as possible. We want to see really nice, smooth control on that ascent going up and making sure that you're getting all the way to the top. So the sensation that I almost would explain it to a patient in the clinic would be you want to feel like you're almost trying to squeeze your calf until there's nothing sort of left in it, like it's almost going to pop to a degree. You want to feel like you hit that top point, and then we really want to control the descent, so that lowering component. And it's that lowering component that's often more beneficial, and it's the part that most people tend to struggle with. So simple way to combat that would be using a count. So equal count up to down. I like to use a 2 to 3 count. It's just nice and slow and smooth. We often talk about slow is smooth, smooth is fast. The reason why this isn't a really big and an essential component for all runners is running is basically built on muscular endurance. We're doing a repeated movement for any sort of distance, whether it's 5K, whether it's a half marathon, whether it's a full marathon, whether it's an ultra. We are doing the same movement again and again and again. And there's been some really interesting studies into muscle use. And what we've actually found is that the calf complex, so the two muscles that make up our calf complex, have the highest output of any muscle group during running. And that actually occurs at the propulsion phase of gait. So you have to have strong calves to be efficient, but it's just an essential because we need that power, we need that strength, we need that muscular endurance. So as we've sort of touched on, you've seen Sean use as well. We use the valve system. So it's a really nice way of looking at a hands-on sort of eyeballed approach. We get a really nice metric, but it's nice to have data too, because it allows us to give a baseline. So in this day and age, obviously wearables have become a big thing, things like Strava. So it's really nice for us to be able to see differences in symmetry. It's also really good if you've got a bit of an injury history as well. And that's why like testing these things frequently isn't a bad idea. It gives us a gauge of maybe is there a big symmetry? So with Sean's example of his Achilles, that sort of 12 to 13% asymmetry between sides, it's enough for us to be clinically relevant. We go, hey, there's something that's going on with one side that's a little bit weaker, a little bit less efficient. Let's work on improving that and improving our symmetry. For those with recurrent injuries, we can kind of use the valve system and our strength testing to isolate specific muscles. So if we've got an Achilles injury or a calf injury or a tibialis posterior injury, we can hone in and kind of go, okay, well, what's our strength look like? What's our movement efficiency look like? And start to sort of work from there. Outside of the standing calf raise, the seated calf raise is just as important. So the seated calf raise tests your soleus, which is the deep part of the calf. This is the part we often see a lot of issues with in clinic as well, particularly if we've got some efficiency issues at that takeoff phase of gait. Quite often the soleus takes a really high workload. So it's really essential that we test both that seated and standing calf raise. The interesting part of this is, and we'll touch on this as well in the performance section, is with your calf raises, from a strength value perspective, and this is the bit that kind of will blow me away the first time I started deep diving into it, is you should be able to do 1.5 to 2 times your body weight. So scale it up and down depending on body weight, but that's a really significant amount of weight that we need to be able to lift in. As Sean said, this isn't for large amount of reps as well. Like when we're getting into those upper ends of strength training, it might be 3, it might be 4 sets max, and we generally will work in a sort of 6 to 8 rep range. So it's quite a small rep range, quite small sets, but it's with that quality movement. So this is where the underloading side of strength work comes in. So if you are doing some strength work, probably something to consider is, what's your weight look like? What do your reps and what do your sets look like? From a muscular endurance perspective, yes, doing lots of reps can be beneficial, but if we're not getting adequate load, we're not going to get that sort of translation into both strength and performance we need for running, particularly distance running as well. So yeah, just some really good food for thought to consider. The other test that we look at more from like an elastic perspective is that single leg hop test that Sean talks about. And this is a really, really big one because it's one thing to be strong, but we need to be able to have that sort of nice stiff Achilles tendon and produce power at the ankle as well. Because if we don't have good power at the ankle, again, it impairs that ability to propel off the ground, be really efficient through that sort of takeoff phase of gait. And if you ever watch runners towards the back end of the race, you can tell when they start to fatigue. They get that really sort of bouncy gait. Maybe you've seen someone out running who looks like they're sort of bouncing up and down a lot. That can often be a really good sign that maybe their calf strength or their power generation at the ankle is something that they sort of struggle with a little bit. So that hop test that Sean demonstrated earlier, using our little pressure plates, what we'll do is we normally do 5 hops each side. There's a couple of metrics that we like to look at with that. So one is the height, so how high you get off, how long you actually spend on the mat in between hops, and then we get a bit of a ratio of the two. So ideally, we want to have a ratio of more than 1. So you want to spend more time in the air than you do actually on the mat. So big things in terms of strength training from the podiatry end of things is working on your calves. Calves are the non-negotiables. Again, if you're in Sydney in about 3 weeks, maybe not the time to start throwing it in. But for Melbourne, we're mid-October, so we've got a couple of months where we can start to build that in. We'll touch on some timing and the performance side of stuff, but calves and power, they're the 2 things that we really want to work through. So footwear. Footwear is a little bit of a passion of mine. I've worked around in that industry for probably about 15 plus years now. So we're in a really fascinating point in that sort of world at the moment as well. We've probably seen the biggest changes in footwear, I think, in the last 5 to 10 years than we have probably since like the introduction of the running shoe. I guess the super shoe, carbon plated shoes has been the big game changer. I was thinking about this earlier today while I was actually out running, and I think where we probably started to see this was early 2000s when Nike introduced Lunarlon. So if you've been around for long enough, you might remember the old Lunar Racer and Lunar Trader. It was a material that was actually taken from NASA's seats in their space shuttles. It was designed to be super light, super bouncy and responsive. but still have good longevity to it. And I think that was probably where we saw the start of it. We blended from that into some of your barefoot era. From your barefoot era, we transitioned into Hoka starting to come to the fore. And Hoka was probably the other big stimulus that changed a lot of the shoes. If you go into somewhere like Running Company, Athlete's Foot, Rebel Sport, nowadays you'll see that most shoes have a really thick stack, so the amount of material in the midsole. And again, Hoka was probably at the forefront of that. Every brand now has a shoe that replicates a lot of those features. So it's a really, really cool time in running. Also, the popularity of running. So I'm originally from Queensland, so we were kind of took up running a little bit up there if you weren't already running, but we were very lucky. But I know from friends in Melbourne that running really, really boomed because gyms were closed. Team sports were all kind of shut down. So running was a relatively cheap and affordable thing that you could do. It was a good excuse to get out of the house, and we're really seeing the flow on with that now. So Melbourne Marathon now sells out in less than a day. So we're also, with the result of increase in running, we're starting to see influencers and that social media side of stuff come into play as well. And there's a lot of information. So big goal I want you to take out of this side of stuff tonight is just like how you can utilize your footwear, the things you want to consider, and how your super shoes can be used, how they function, and kind of some do's and don'ts. So, if you've ever spoken to someone that's been around running a long time, you've maybe seen a podiatrist, a physio, or you've just kind of been paying attention online, you'll hear people talk about using multiple sets of shoes. And it's been really interesting that we've seen a really big bit of a breakthrough in some of the data in the last probably 10 years. We've always sort of recommended using two shoes generally for training and then maybe having a race pair, but they did find that if you're using at least two sets of shoes in your training rotation, it can reduce injury risks up to about 28%, which is quite significant. Touching back on what Sean said earlier, it comes back to the load perspective. So it allows us to alter that load and the stress that we're putting through our legs. The big secret is, though, you need to be using two different types of shoes. So two of the same shoe, because they're usually going to be the same material, they're going to function the same way when you actually run in it. You're still going to put the same sort of loads and stress through the same tissues in the lower limb. So you don't necessarily get the same effect. So it's really, really important to consider the types of shoes. And it's a really fun way to just experiment. Like if you want to play with some different shoe options, here's your chance. It's one of those ones that, obviously shoe lifespan as well is probably something to consider in this too. It does help to preserve your shoes a little bit more. It gives the shoe a bit of recovery time, allows that material to kind of return back to shape. And a big issue that we're starting to see now is obviously the wear and tear in shoes is nowhere near the same as it used to be. So traditionally a long sort of long run, your high mileage shoe used to be 700 to 1,000 kilometers was the recommended lifespan. Nowadays, we're probably seeing 500 to 700 if you're really, really lucky. And that comes with the territory with a lot of the changing materials that we're seeing. So something to be mindful of. A lot of the brands are starting to sort of accept that and talk about it a lot more, but just something to consider. Just because your shoe might look okay, quite often there's a bit more wear and tear to it. A really good sign to look for is creasing in your shoes. So if your shoes are starting to crease quite considerably, the outsole tread might look really nice, but the shoe's probably closer to its sort of lifespan than you think it might be. When you're considering multiple shoe options, I want you to think about it from its purpose. So you want to marry a shoe to what you actually want to use it for in your training week. Are you buying it purely just on looks and aesthetics and you want to test something out? Or does it actually have a purpose and a place in your weekly training cycle? So this is probably the best way to maximize your shoes is marry your shoes to what they're trying to do. So having a shoe for your easy runs or just your recovery runs, it's a great one. A really good example, there's a podiatrist I know of who has won very big races and has performed at Olympic level. His training shoe is a very, very basic ASIC shoe. It's a $160 shoe. It's nothing flash, and that's his recovery shoe because he's just like, it's a really simple, safe option. It's It's got a good lifespan and it fits that role perfectly. So having a shoe that you know is almost like your Old Faithful, this is a really nice sort of space for that. It's something that you're going to probably buy every 3 to 6 to 12 months. That is a shoe that you always have. That's where you have that really nice sort of safe recovery shoe. Having something that's more for your long runs. So again, this is where some of your more beefed up shoes that we're seeing, so your Ghost Max, your Glycerin Max, um, things like your Kayanas, your Nimbus, things in that sort of territory that are a bit more substance to them, plenty of cushion, plenty of protection underfoot, something in that sort of realm. Um, you can use your super shoes sparingly in this sort of category as well. For your faster pace runs, that's where we probably will start to consider more your super shoes or something that's a little bit more tempo based, or for maybe your threshold and race replication, where you want to replicate more what you're going to be using on race day, but also get the benefits from the shoe. The other cool thing about the super shoes from a clinical perspective for us is that as well as being able to use them from a performance tool for our runners, we're also using them a little bit as an injury tool as well. So with the rise of things like rockers and carbon plates, they've actually been really handy with particular pathology. So a lot of forefoot pain, some ankle pain. I've got a few Achilles patients that we use them in as well. So they're not just from a performance aspect, we can actually use them from an injury aspect in a way that maybe traditionally we might have used like a post-op shoe or a moon boot in some scenarios when we have got some really significant pain and injury. So cool to know that they have both a clinical purpose as well as a performance purpose as well. So your super shoes, why do they work? We're still learning a lot about them at the moment. Originally, we used to think it was carbon plate driven, but we actually are starting to find it now. It's due to the foams that we're using. So the foam is basically a mix of weird things. A lot of the brands aren't telling us anymore. So it's no longer just EVA rubbers. We're using PBAX, PBA, TPU, all sorts of fancy rubbers and space age materials. The Saucony, the Elite, the brand new one, is using a foam that they found this sort of substance in a lab. So it's really fascinating if you want to read up on that. But basically, though, the energy return in those foams is what is giving us the performance boost. The carbon plate just acts as a stabilizer, so it gives it a firmer platform to work off. You'll see the flow-on effects in this in a lot of other shoes now, how they're much softer, much more compliant. So they feel a little bit more marshmallowy and squishy underfoot. And that's the flow on from our super shoes. So that's kind of where we're at in that horseshoe of really soft and really firm footwear at the moment. The awesome part of these midsoles is the energy return from the midsole allows for greater power at that propulsion of the takeoff phase of gait, but it actually means that we're putting less effort through that calf complex. So if you've run in old racing shoes in the past that were a really thin, really firm rubber, you'd usually pull up from a race quite sore, particularly in that sort of calf, maybe the Achilles. Nowadays, if you're racing in a super shoe, that's why you don't pull up as sore, is because we're able to work more efficiently, producing more power, but not having to work as hard. The other benefit of this is it's also allowing athletes now to start putting more intensity, more thresholds, more sort of race simulation into their training load each week or each block than they were previously capable of. So, if you're able to handle those higher loads, those more sort of intense loads, it allows you to sort of utilize that style of training a touch more, which is a really cool facet. As Sean said, though, you have to be very careful with that. So you're making sure if you're working with a coach or a plan, consider those things. So there is trade-offs with super shoe use, though. Super shoes aren't to be used for every run. I have seen Nike Vaporflies used as going to the groceries or every run around the Marby. And that's not where they're intended to be used. They're not super comfortable for those sorts of situations. They are designed for more performance-based situations. People that are using super shoes quite frequently, you could definitely ask Sean and any of the physio team. I know the podiatry team seeing it. We do see an increase occasionally in stress fractures as a result of these. There's a little bit of conjecture out there. Are they increasing the risk of hip and femoral stress fractures or stress injuries? So just be very mindful of those sorts of things. Part of why that tends to go awry is they increase the amount of time that your foot actually spends on the ground, and you put a lot more force into your foot, into the shoe, basically to generate that power. So we are putting a lot more load to the foot. The other thing is they've got a really poor lifespan. There's an Adidas racing shoe that is designed for one marathon. I think Australian dollars, it probably has a price point of close to $900. So yeah, you've got to consider those way up. So hence why we want to use them sparingly. So big things from a footwear perspective. Pinball. Pinball, that shoe selection, helps alter that load. It allows you to run in some different stuff. I think it's always fun to have some different shoe options, but it's really nice from a lower limb perspective. It helps us manage our load a little bit better, can help with some of those injury risks. As we said, don't go running in multiples of the same shoe. Consider varying your types of shoes. Super shoes are a really good tool to have in your arsenal, and they can be used from a training perspective, but make sure you use them sparingly. So don't go using them every second run. You want to pick and choose your sessions and make sure you sort of manage that lifespan. Because if you want them good for race day as well as training, start to think about that stuff now. Just remember that true lifespan as a whole has started to reduce. So be mindful even with your traditional mileage trainers. And as we said, you can handle more load in your super shoes, but there is a bit of an increased injury risk as we start to push those things. So be mindful of those little niggles and tweaks that Sean discussed earlier. And lastly, so from a performance perspective, one of the big factors that predicts running performance is our running economy. So how efficient we are. If our running economy is better, we will generally see an increase in our ability to maintain that sort of our performance or increase our performance, increase our pace. So the big thing, and you'll hear us talk about this a lot, whether you chat to us in person, here tonight, or in the clinic, is we're massive advocates for strength work. We can all account for the benefits that we see. The guidelines are with strength and plyometric exercises. The goal is 2 to 3 sessions per week, and you want to aim for 8 to 12 weeks so that we can actually see optimal effects. So it's really, really important to consider planning that into your training week. That 2 sessions a week is what I work with most patients in the clinic. It's usually pretty reasonable. And if you're already in the gym, it's about just making sure we build in those essential movements into your program. But as Sean said too, some of those little things that you can build in, like potentially but the ability to do it at home as well. So really, really essential that we get in the gym. It's a must if you want to perform and perform well. The other part we sort of want to consider, and Sean touched on this with our movement efficiency, is assessing your running gait. So being able to sort of identify areas where we can improve that efficiency. The biggest thing to think about is with running assessments and running gait, we don't want to change how you run. We just want to improve how efficient you are. So it's like little small areas of improvements, whether that's drilling, whether that's using some technique cues, or whether that's building in strength work to replicate what we want to achieve. And then alongside your strength and your technique work, it's appropriate training load and sessions that are essential for your performance. So you want to ensure that, as Sean touched on, we don't want to rapidly increase our load. We want to make sure, though, that you're also introducing adequate sort of speed or hills or those more intense sessions. Depending on what you're doing race-wise, you want your sessions to replicate that race. So, your threshold sessions, your speed sessions, your hill sessions, you want them to be able to translate into the type of racing that you're doing. So, if you're racing a marathon, you might consider doing longer sessions or threshold sessions at race pace slightly quicker, but over longer efforts. Whereas if you're racing a 5 to 10K, we might look at more that sort of 400 to 800 meters, those really short, sharp, high-end efforts. So looking at, 80 to 90+% of your capacity. So it's really, really essential to think about how does your intensity and those really quality sessions feed into the racing that you're doing. A big one, and it took me until my 30s to realize this, is the 80-20 rule. It's still a key focal point with your training sessions. And this is a really good way of managing your training type. So we still want 80% to be in that sort of low to medium, that 20% at that sort of more high end. There's a reason we do that, and it's just to help manage load and reduce those injury risks. Again, if we start to push that into more intensity, our risks of injury start to creep up through there. So really, really basic one, looking at your training week and discussing that with your coaches. Don't play catch up with sessions. So if you're sick or if you're injured, don't try and play catch up. Sean's injury example is a really, really good case. Having that week where you're still active, your body still likes some low load, but we just don't want to push it. And And as we said earlier, with the footwear stuff, making sure that if you are doing some race replication or your speed performances, that's where you can utilize those super shoes. So you can push that a little bit harder. Maybe you want to replicate what race day is going to be like. We don't, it's like testing goos and gel and those sorts of things. You don't want new things on race day. So big things from our performance is 2 to 3 days of strength and plyometric work a week. It sounds like a lot, but it's really simple. If you've got a good coach, or again, you pop into the clinic and chat to us, we're always more than happy to help try and find something that works into your schedule. Your gait is a really nice way of just becoming a little bit more efficient, looking at using both the strength, your technique, your drills, and your cues, just to try and improve your technique work. Um, Good load management. It's not just for performance, it's also for injuries. But yeah, that 80-20 rule is still a really good one to keep in the back of your mind. Speed sessions, make sure those speed sessions replicate what you want to achieve on race day. You want to make sure that you're going to do things that are going to give you that payoff that you want. And your super shoes, they're a great tool, awesome for race day, awesome for your performance and high end work, but use them sparingly and use them smart. Awesome. I'll hand you back over to Andrew.
Awesome. Thanks, Lockie, very much for that. I think one of my biggest takeaways from that is that you can never have too many running shoes. And I'm definitely going to reference you when my wife complains about my growing running shoe collection. Um, so we imagine there's probably some people out there with lots of questions. If we don't get to everyone's questions, we will have a put them in anyway, because we will be able to send you an email with a response. So if you've got something that you'd like us to chat about, please throw some questions into the chat little chat box now, and we can answer any of your questions. But otherwise, hopefully, for all of you who attended, there's at least one or two takeaways that you can use now. I think what we want to try and do is that a lot of you who are running, either you've got events coming up or you just love running and you want to keep running, finding things that you can use now, whether it be considering what shoes you're wearing, whether it be throwing some plyometric, some strength stuff into your training, or managing an injury before it develops into something a little bit more serious, can be really, really important in making sure that we obviously keep running and keep enjoying running. So, do we have any questions? We'll give it a couple of minutes if you want to throw some questions in. Yeah, so we've got one. Um, I might throw this one to you, Sean. Is there a general rule for how quickly load can be increased?
Yeah, it's a good question. I think that if you look online, the general advice is 10% per week. I think that's relatively unhelpful, in the sense that everyone's very different. If you've been running for 20 years and you've got a fantastic training history behind you and you normally run 60 Ks a week, that can be probably a little bit more and a bit more aggressive. Whereas, if you're a very new runner and you're somebody who is building up the mileage and you've just got to 5K, I think then that's maybe a little bit too much. I think 10%, if you are someone who hasn't got a big injury history, is fine as long as you take your bone holidays every 4 to 6 weeks. The other side of that, though, and there's a bit of nuance to it, is how many runs are you doing a week? Are you doing that run to run? Or are you doing that week to week? I think just the key thing is that you're taking a weekly kilometer mark or a weekly mileage rather than going, I'm doing one run and my next run's 10% more, my next run's 10% more. Do it off your weekly volume. So I think in a nutshell, if you're very experienced, probably can go a bit more. If you're relatively new, I think it may be a bit too much. If you don't have a big injury history, it's probably sensible. Just make sure that every 4 to 6 you are taking your deload. So I think, yeah, answers from me generally diplomatic and nuanced.
We've got a question from Anthony, who's a little bit of a glutton for punishment, I think. He's running both Sydney and Melbourne. Um, I'll throw this one to you, Locke. How many rest days after Sydney? How should he get himself right, ready to back up a marathon?
Running related rest, I'm 5 to 7. I would go maybe around 5 days of rest, but you can have some active recovery in those days post. So things like Sean mentioned earlier, getting on the exercise bike, getting in the pool, going for a walk. I'm a really big fan of like the day after the marathon, get out, go for an like a coffee shop walk and take your time. Might be half an hour, might be an hour. Getting it moving, I find you help in terms of recovery perspective is really, really good. But from a running perspective, yeah, that 5 days of rest, 7 is kind of my sweet spot. But active recovery in that sort of 5 days before you go back to a run. Um, Kind of gauge it on how you pull up pain wise would be my other sort of key point with that too. So, if you're feeling pretty good by that sort of day 4, day 5, go for it. In terms of your first runs back, they are all easy. So you want all those runs in that first sort of week to 2 weeks post race. You want them largely done at your zone two, if we're going to use the common terminology. I like conversational pace. So use them as more social runs where you can have a bit of a chat. You're not pushing the body hard because you're still going to be recovering in that sort of those first few weeks as well. So no intensity. It's all easy. But active recovery is okay.
Excellent. I've got a question from Javier. Should I avoid plyometric exercises that are heavy on the foot after just recovering from a metatarsal stress fracture in the prep for Melbourne? I'll throw that one to you, Sean.
Yeah, I think if you're pretty soon after the stress fracture, then yes. You do want to dose plyometric exercises at some stage. So this is one of those injuries where I'd want to be really specific under the care of a healthcare professional because of the risk if you get it wrong. So if you get it wrong, you're heading back on that trajectory towards stress and further injury. So plyometric exercises shortly after, absolutely we want to limit those and not do them at all. But they're depending on how far you are post injury, there's going to come a point where that's going to help strengthen the bone. So I think there's a lot of caveats in that.
We've got another question. What sort of things can you look to vary in your shoe selection while maintaining a bit of arch support? I'll throw that one to you, lot.
Um, so there are your traditional arch support shoes are kind of no longer in existence. There's probably a small handful that I can count on one hand. So the new Nike Structure is probably one of the few rare ones that's a bit of a traditional sort of support shoe. We are seeing the introduction now, though, of Brooks have probably done this the best, and that they've actually integrated some of their more what we used to call like their tracer categories, so their training racing style shoes. You can get a shoe that's still got plenty of substance through the midsole, but still has a bit of a guidepost or something similar to it. So you still get those support features that you would like, but you still get the benefits of that more sort of performance training style shoe. Other thing to consider too is a lot of your shoes now. So the Asics Superblast is probably a really good example of this. If you look at it from, actually, I've got my super shoes sitting here. So if you kind of look at them side on, they tend to flare a lot more side to side. So while you don't get that necessarily firmer material through that arch and that rear foot, the shoes themselves are passively a lot more stable because there's a lot more shoe in contact with the ground as well. So that's another thing to consider. Obviously, having a chat to a pod or a physio in that sort of realm as well is good for guidance because it depends on why you're using that shoe as well. Is there an injury history? Is there a reason why we need that specific support, or is there a certain degree of support and control we might want with that? But yeah, looking at to some of those training racing style categories that have like a guidepost, the Brooks Launch GTS is probably the first one that springs to mind. Ultra do the Paradigm. There's a few options out there, but you can still get the benefits of your performance shoes. You just want to look for something that still fits into that sort of guidance category. So you can still get the best of both worlds.
And I guess, yeah, you could always, some people may benefit from an orthotic in a running shoe as well to help provide that little bit of more personalized arch support if it is required. That can be obviously a great sort of short-term management tool. Um, Thoughts on running economy testing? Is it worth it? Currently training for my first marathon. Either of you.
I think.
Um,
Oh, sorry, jump ahead, like.
you go. I'd love to hear your thoughts on this too.
I think it depends how serious you're taking it. If running's your passion and you want to know what your running economy is and you're really interested in it, I mean, why not? I think the key thing is that I would be doing it under the guise of you're going to do something to improve it and retest it, probably. So I think in terms of if it's worth it, it's not something I tell people to do necessarily, but if you're really interested in it and you're really into your running, go for it. Keen
Anything
to
you want to add, Lob?
Yeah, and I think, yeah, as Sean said, I think find a reason why you want to do it. Are you going to retest it? Are you going to use it to help guide what you're doing strength wise? Are you going to help use it to guide what sort of work you want to build into your training plan? Is there some technique work that you want to look at that you're going to try and improve, whether it's with cues or with your strength work and those sorts of things? So, um, I think, yeah, it needs a purpose. You don't just want to do it as a once off. Give it some purpose and give it some value so you can see some improvement in it yourself.
Yeah. I think this one's a good one for you, Sean. Can you run through a chronic knee pain that goes away when the knee is warmed up mid-run?
If you're not getting pain afterwards, you're not getting pain into the night or the next morning, and you're not getting swelling, then yes.
I think that's pretty clear cut. That's good. Locke, I'll throw this one to you. Any views on the importance of cadence?
Cadence is a really good one. We can use it from two perspectives. So we can use it from an injury perspective. We can also use it from a performance perspective. So sometimes I'll play with cadence in the clinic from an injury perspective to reduce how long our foot's on the ground. It's one of those things that sometimes with shin pain and knee pain, it's a really handy one. Pretty much all your watches now, whether it's an Apple Watch, Garmin, Sunto, whoever you're using, you can actually put your cadence as a like a display so you can see it. So sometimes I'll get people to increase their cadence if we want to reduce how much time the foot and the lower limb is in contact with the ground, which helps to reduce some force. Um, from a performance perspective, what we'd actually do is we'd normally look at your run in the clinic, but also pulling your data from a race. So if you've got some race data
Hmm.
or like a speed session that you've replicated what you would be using or what race pace would look like, having a look at your cadence, we would want to pair it with obviously how you're running as well, because we don't just want to up cadence for the sake of upping it as well. We want to make sure that it's going to be efficient. If that's viable, absolutely, it's something that you can play with. A simple trick that I give most people is if you really want to, you can run to a metronome. I think that's a little bit chaotic, but I've got some people that do. A simple hack is if you listen to Spotify or whatever streaming service, usually you can search a playlist at the BPM. BPM equates to your steps. And I normally work with 5 steps per minute faster than what you've been going for. Again, as Sean said, if you're quite experienced runner, you can maybe go like 10 steps faster, but it is a big shift and it takes time. So I normally like 5 beats per minute in a 2 week block and then increase from there. And again, be mindful that what the generalized metrics are don't necessarily carry over to everyone as well. So, you might have a really long limb, so your cadence might naturally be a little bit lower even at your faster paces. So your faster pace, let's say you might run at 165, your race pace, your goal might be only get to 170, 175 instead of that closer to 200. So there is some variability. So be mindful that it's not a one size fits all approach.
Yeah, I think it can be a really useful tool to help make some gait changes, because it does help give you that little bit of feedback when you're using a metronome or something like that, because it can help keep you a little bit accountable. But yeah, it's working out what your current is and how much you want to change it. Um, can you swap out and use the same orthotics for different shoes, or should you have multiple that are molded for each pair, Lucky?
Again, so it'll depend on what they were prescribed for in terms of like the injury or what their purpose is. Some shoes they'll be able to swap across fine. It's more so just going to be the fit that I find is the big issue. So making sure that they're shaped correctly, that the pressure points and where they're applying their force under your foot are still appropriate. So you do need to get that assessed. Using them in the race shoe is probably the one exception where you need to have a conversation. Is it needed in the race shoe? Can you race without them? Will they fit your race shoe? Because that's also the other big thing as well, is that quite often your race shoes, so I'll grab the inner sole out of mine if it comes out. That won't. But usually your race shoes, what you'll find is they're really quite narrow through that midfoot, and you're
Mm.
going to find a lot of the bulk of your orthotic is going to sit through that midfoot. So it'll quite often sort of overhang in that sort of high point of the arch into the big toe joint. That's usually where most of our blisters and pressure spots tend to occur as well. And if it's also not sitting in your shoe correctly, it may be ineffective. It might actually cause more harm than good as well. So you can swap them between, but you need to make sure that the shoe is viable, it's suitable, and what your pathology is. So a few
Yeah.
little things to consider.
This one's probably for me, given my love of trail running. Do you have any general tips for first-time long-distance trail runners? Um, Definitely get off the road and find some hills. It can be a challenge in Melbourne. You sometimes have to travel, but I know personally, I found a hill that was about half a kilometre long, and I just did reps of it and lots of them. Find stairs. One of the biggest tips that I got for trail running is the biggest challenge is the loading when you're descending, not actually when you're going up. You can actually practice the going up, even on a bike, is using the same muscles, but it's really hard to replicate descending. And it's often the descending that catches you out. It's the constant eccentric loading through your quads, through your glutes, that often is what blows your legs out towards the end of the race. So lots of efforts going up, but you also want to do lots of efforts going down. So find some long stairs, some half decent hills, and get off the road, find the trails. Yeah, trail running should be as much as you can on the trails. Absolutely do some of your runs on the road, but definitely I think a really big tip is to practice the descending as much as the ascending. We might make this the last question, and I'll throw this to you, Sean. Recovery tips post long runs. So, given the fact that everyone here is doing at least a version of a long run, and it's obviously relative for everyone, what can people do to help be able to then get ready for their next week of running?
Yeah, I think like recovery post long run starts pre-run. So fuel really well for your long run. It's going to help you post, but then post your two priorities are sleep and nutrition. I think we spend, or what I have the conversations a lot with people is they're doing one percenters. They're doing lots of foam rolling. They're doing lots of ice baths. We're doing lots of these sort of passive therapies, which are fine and they can definitely help a little bit. But the key big ticket items are going to be post long run, get your nutrition right, and refuel really well, but then sleep. And look, it may be the case that with your life schedule, you're maybe not being able to sleep more that day, but if you can really prioritize the quality of your sleep, so ditch the phone 30 minutes before bed, no caffeine, definitely 6 hours at least pre-bed, dim the lights 30 minutes pre-bed. All these things are going to help you get better quality sleep. So sleep and nutrition are your key things.
Yeah, that's great. Awesome. Well, thanks everyone much for joining us tonight. Hopefully, as I said, you've got some things that you can use straight away. We're going to send everyone out an email with a copy of the recording. So please share it with your running buddies and any of your running group. And also, we're going to send out an offer for you to take advantage of the valid strength testing as well as the running gait assessment. It's a wonderful tool. It can give you some really, really good quantitative data. We know as runners, we love data. We love all the information that our watches and this technology can provide, and it's really, really transferable to performance. So the stronger you are, the longer you can run, the longer you can maintain good form consistently, makes a huge benefit to your ability to get that PB, enjoy your running first and foremost, and hopefully stay injury free. So thanks everyone for jumping on. Have a wonderful night. Wish you all the best with your upcoming events, either Sydney or Melbourne or any others. Most importantly, go out and enjoy yourself. It's a wonderful sport running, and we love it, and we hope you do too. So all the best. If you want any questions, please feel free to hit us up. We love talking about running. So we'll look forward to seeing you in the clinic, hopefully for more of a performance side rather than the injury side. Thanks, guys.